So we've got the chief complaint of the patient is that the lower left molar needs a bit of a filling, right? So I'm going to have a look and you guys can come with me. So if you want to bring the camera around. This point here seems to be the issue. I don't know how much you can see that on camera. Now I'm just going to probe in here to see how soft it is. It's pretty soft. Okay, so that seems like it's quite deep. Are you feeling any pain here? If you turn your head towards me, where this decay is quite deep, it can get quite close to the pulp, in which case we want to just make sure if the pulp is vital or not. This is the nerve of the tooth, the blood supply in the nerve, and we want to just make sure. So how we do that is by using some cotton wool here, and we will spray it with some freeze spray, and then we're going to test how sensitive, if at all, it is. And if the patient doesn't have any sensitivity, no pulp. But if there is, we can hopefully save that. And what I'm trying to do is just get it onto this tooth, and we'll see what the patient reaction is. Any pain, any feeling? Can you feel that at all? You can? Okay, can you feel this one? So try to go into the neighboring teeth as well, to see what the other reactions are like. Do you feel that? Okay, tell me, do you feel this? Gone quite deep, right? So we're going to now clean that out and see how much we can save. Letting you know now. This probably will need anesthesia. Are you okay with that? Do you have any allergies or anything? Cool. So we'll numb you up because this is quite deep, so it's going to be uncomfortable if I do it without the anesthesia. There is a chance that it's going quite close to the nerve, and if that's the case, then we'll have to do a root canal potentially. I'm just going to get rid of the unsupported and the undermined enamel. What I like to use for this is nothing too aggressive, so I typically go for a yellow. So anything yellow or white banded is relatively fine, and this allows me to have a lot more control when cutting off this undermined enamel. I'm then going to go with a low speed, which is this handpiece here, and remove any of the soft infected dentin. We're going to clear that up and hopefully take it from there. We're going to start without anesthesia. If the patient is feeling uncomfortable, then we'll administer it. So let's start with this. Then, so at this point, you shouldn't feel any pain at all. Any questions?
No, so far.
Okay. So we have cleaned everything up with a high speed around the outside. The unsupported enamel is now gone. So we've got healthy enamel waiting for a filling. The inside decay just needs to come out. So how we do this is excavate this using a micromotor, which is the slower RPM. And then we're going to pick out a ball here. Something like this is absolutely fine. I don't know if you can see that. I just hope that now when we get rid of the inside bit, it's not too deep. Most of it will get covered. You might still see some of this black, but when I clear this up, hopefully we will clear this black stuff from the inside out. Yeah. This is the low speed, works at lower RPMs. We're looking to clean up the infected dentin now. Thank you. I'm going to try to keep this as pain-free as possible, but you might feel some sensitivity here. Okay. Now I know my mask is down, guys, but that's because if I need to say anything, you can hear me. Doing really well here, by the way. So I'm just going to rinse that off.
You're very funny.
Thank you, I try. I try. This is all your lovely gunk.
Oh, wow.
Yeah.
It's perfect.
You can taste it if you want. So now a little tip, when you are doing this, it's best to keep the area dry so that the dentin doesn't soften up with the water. I mean, it's not going to soften up a lot, but you might get false reading. So. So the next step after this will be the etching. This is the blue liquid that we put on to roughen the surface of the tooth so that it holds the filling material better. Does that make sense? There you go. Okay, cool. Etch the enamel for 15 seconds. So we're going to keep everything dry because now when we put on the bond and the composite, we need everything to be super dry. So I will air dry everything one more time. Cotton roll I'm using vestibularly is nicely placed. Okay, so now no more mouth closing allowed. Air dry bond, please. On a micro brush would be great.
Yeah.
I will go in with the brush, agitate with active brushing. is on both the enamel and the dentin, and I'll blow this adhesive very lightly in before doing a second layer, just to make sure I've hit all the nooks and crannies and that we've got a good adhesive protocol, because fillings stay if the adhesive is good. Flow would be great. Thank you. At the same time, could I get, give me an A1 please. Could I get, light cure please. Oh, A1 packable, thank you. Can I get the light cure one more time please?
Yeah, sure.
If you feel like you made a mistake, just cover it. Don't think that you're a pro, just go over it again. The patient will be happy. Okay, so where this cavity is quite deep, I will start with a flow. This is just personal preference. I know some people like to go in with packable immediately, but I like flow, I like to agitate. So what I'll do is I'll place it down into the base of the cavity. Just turn your head again to me all the way, brilliant. If you can try to keep your tongue to your right, just so we don't make it wet, that'd be good. This next bit, gonna ask you to open up nice and wide so I can get to the back. That's perfect. And I'll just put this. So at this stage, because I am pretty happy with that, I'm just going to check the margins. So we'll use a probe for this. Okay, that's your before. You used to have a beard, okay? Your before was this. Yeah, this is how we started, okay? So we started like this, and that's the same picture, and then we started cleaning it. That was just the outside wall. And then I believe this is when we cleaned a little bit of the inside as well. Better shot. And then other than this little line of old staining, this is now your new tooth,
Wow.
okay? We're not gonna have a perfect match of color from your tooth and what we have. But over time, that line will stop showing, because when you eat food and the staining matches, you'll have perfect normal tooth. This stain will never go because it's inside, but no one's gonna see this.
Yep.
So if you're happy, I'm happy. You have been an amazing patient, honestly. So thank you, and thank you for helping so much. It really helped with everything. It's a pleasure. So there you have it, guys. I hope that was a good enough rundown for what a typical student here at UPJS can get their hands into when it comes to dentistry. And that was a pretty basic filling that I carried out with a very cooperative and pleasant patient. Of course, you get people from all over the world here, so things can get tricky at times. Just stay happy, and people usually mirror the same attitude. I hope you've learned something from this. I'm not perfect yet, so I probably did make a few mistakes, but trial and error, you just keep going, get the reps in. Please leave your comments and your feedback below. I will hopefully be doing more of these in the future. If you have any questions, just let me know and I'll get back to you as soon as possible. Thanks for tuning in, and I'll see you in the next one. Take care. Bye-bye.